Assalamu alaikum. In today's video, we will master opioids, analgesics and antagonists. Following are the landmarks of today's lecture. Opioids. It is a class of drug that relieve the pain. They are also called as analgesics. For its better understanding, first we will take a look at the ascending and descending pain pathways. Ascending pain pathway starts from the nociceptor. These are the highly threshold primary sensory neurons that carry the pain signal through the first order neuron to the nucleus cuneatus and gracilis, which transfer the signals through the second order neuron all the way to thalamus, and in the last, with the help of third order neuron, pain signals are being spread to somatosensory cortex. Somatosensory cortex perceive the pain signals and send them back to the descending pain pathway. Main function of descending pain pathway is to allow the organism to respond to pain source by reducing the pain signal. It begins in periaqueductal gray area in the midbrain that processes the nociceptive information and relays it in rostral ventral medulla. These neurons in the rostral ventral medulla send down the pain signals to spinal cord and activate endogenous opioid system to suppress the pain. Now, what are endogenous opioids? Basically, opioids are divided into three types. Endogenous opioids, these are naturally occurring opioids in our body. For example, enkephalin, endorphin and dynorphin. Natural opioids, they are basically obtained from opium poppy. For example, morphine and codeine. Semi-synthetic opioids, these are chemically modified opioid. For example, hydrocodone, oxycodone, and last one is synthetic opioids. These are chemically formulated opioids. For example, fentanyl, methadone, and meperidine. Now coming back to the endogenous opioid system, in pain signaling pathway, specific neurotransmitters, for example glutamate, substance P, and calcitonin G receptor peptide, these are responsible for the pain transmission. Glutamate act on the NMDA and AMPA receptors postsynaptically, causing the influx of sodium and calcium, resulting in depolarization. Calcitonin G receptor peptide, CGRP in short, binds to the neurokinin receptor 1 postsynaptically and stimulate the arachidonic acid pathway that in result also stimulate NMDA. In this way, the pain signals are being transmitted. Now, function of endogenous opioids is to inhibit this pain transmission. They do so by binding to specific opioid receptors. For example, myco, kappa and delta receptors. These are G protein coupled receptors present in various areas of the body. Opioids bind to opioid receptor presynaptically and inhibit calcium conductance. As a result, it inhibits the release of neurotransmitter presynaptically. At postsynaptic terminal, opioids stimulate potassium channel, causing the efflux of potassium, resulting in hyperpolarization. Coming towards the uses, opioid bind to kappa receptor, decreasing the GIT motility and is used to treat diarrhea. Mainly diphenoxylate and loperamide are used for this purpose. Codeine and dextromethorphan, they are mainly antitussive drug. They relieve the cough by stimulating the myco and kappa receptors in the cough center in the brain. Opioid also reduces preload and pulmonary capillary pressure and is helpful in treating the pulmonary edema. They are also used in sedatives and analgesic drugs in the induction of anesthesia. Opioids also causes some various adverse effects. To easily memorize the adverse effect, I have an easy mnemonic for you guys, that is morphine. Opioid causes meiosis by stimulating the pupillary sphincter muscle, orthostatic hypotension by vasodilating the vessels, respiratory depression by overstimulation of mycoreceptor in the respiratory center. Codeine, morphine and fentanyl suppresses the immune cells, making the patient more susceptible to pneumonia infections. Opioids release histamine to decrease the vascular resistance and blood pressure, resulting in orthostatic hypotension. Infrequency means constipation and urinary retention. Nausea and emesis by stimulating the chemoreceptor trigger zone. Euphoria to relieve pain. Opioid cause powerful spike of dopamine in the brain, resulting in euphoria, that means excitement. And last one is dependence. If we suddenly stop opioid administration, it causes opioid withdrawal effect, which varies depending on the time since withdrawal. It is divided into three stages. Stage 1 is up to 8 hours. Patient become anxious and craving for the drug increases. Stage 2 start from 8 hours and end at 24 hours after withdrawal, resulting in anxiety, insomnia, GIT disturbance, rhinorrhea, mydriasis, and diaphoresis. Stage 3 starts after 24 hours and remain for 3 days. Major symptoms in this stage are tachycardia, nausea, vomiting, hyperthermia, diarrhea, fever, chills, tremors, seizures, and muscular spasm. So it is advised to gradually stop the administration of drug. To treat opioid side effect and withdrawal symptoms, we can use opioid antagonist, for example, Naloxone and naltrexone. Their major side effect is hepatotoxicity. That's the end of my today's video. Hope you enjoy this video. See you in next one.